There are 5 things that you should never say to your doctor. And that's literally what we are talking about today. Guys, I'm Dr. Jen Caudle, practicing family physician, on your health expert and video creator. I am literally just home from the office, and I had some experiences in the last week or so that made me say, you know what? I think we need to talk about things maybe that patients should not say to their doctor. And you might be surprised at these. All right. So the first one is the first thing you should not say to your doctor is you should never say yes when you mean no. What I mean by that is, let's say your doctor wants you to take a certain medication or wants you to take a certain brand of a medication. And, honestly, I know sometimes as patients, you may not want to hurt your doctor's feelings. You may not want to say something that goes against what they think. But honestly, it's really important to speak up and speak your mind and let us know what you think. So if the answer is actually no, please don't say yes. In other words, you should never be untruthful, even if it is for a good cause, meaning like you're trying to save the feelings of your doctor. Don't worry about it. We got that. We got that side. We want you to be honest and truthful. Second thing you should never say to your doctor is nothing at all. What I mean by this is specifically, every now and then it will happen where a patient of mine may have an issue with someone at the front desk of the office or maybe with a staff member. And usually what happens is the staff member or the front desk person will come to me and say, hey, I just had this conversation with Mr. Such and such or Mrs. Such and such, and it was a pretty tough conversation. They were upset or they were yelling or they had this to say or et cetera, et cetera. My staff, and I would argue that the staff of many doctors, most commonly, they tell us, okay? They tell us what's going on. They tell us any problematic or difficult encounters that they have with patients. And so what oftentimes though happens is this encounter will happen with the staff, but then I'll go in to see the patient that day or maybe the next week or what have you, and the patient will not say a word about it to me. Now, I'm one of these people that I believe in honesty and transparency and being fully upfront. So I'll actually bring it up and I'll say, hey, I was talking to my staff and they mentioned a conversation that you all had last week. And I know you had some concerns about this or that or whatever. I'll go ahead and say that because I want to bring the issues up on the table. But one thing you should never not say to your doctor is sort of nothing at all. Now, granted, doctors, we don't always deal with sort of administrative things. It's very true. We don't always deal with interpersonal conflicts and stuff like that. But the idea is I want you to tell someone. If you're not telling your doctor, make sure you talk to the office manager or make sure that you express your concerns because it's really not something that I want to see my patients go through where they have these problematic encounters, say on the phone with staff, with other people in the office, but then they come to see me and act like nothing's ever happened because something has happened. And I do think that that can impact the relationship or your experience in the doctor's office. Okay. So even if it's not me, make sure you bring it to my office manager. That's certainly how I feel about it. Okay. The third thing you should never say to your doctor is, oh, it's probably nothing, or it's not a big deal, or yeah, no, I don't think it's anything at all, or yeah, I'm not worried about it. The reason why is because, well, you could be wrong. Okay. The idea of sort of downplaying and sort of minimizing or dismissing your symptoms, which you may actually fully believe exactly what you're saying. However, that actually could give the doctor the impression that it really isn't a big deal or that it's nothing. Now, as doctors, it's our job to investigate no matter what. That's how I feel. But, what I don't want you to do is to lead your doctor down a path that implies it's nothing. It's nothing at all, et cetera, and that it doesn't need to be evaluated. Whether it's right or wrong, sometimes we take our cues from the patient in terms of determining what we need to do and what needs to be dealt with. So if you have symptoms, I mean, it's okay to say, I'm not really sure how concerning this is, okay, to be upfront about that, but don't necessarily downplay it or dismiss it, even if that's how you're feeling on the inside. And you can let us know that, look, I don't know that this is really anything, but I do think it's important to get your opinion, et cetera, et cetera. Do that, because if you're seeing a doctor who is taking cues from you only, which probably shouldn't be the case, but if they are, they may dismiss something that needs to be looked into. And again, it's not that this is your problem or your job, but I don't want you dismissing anything that shouldn't be dismissed. Okay. So keep that in mind. The fourth thing you should never say to your doctor is, oh, are you the nurse? And I say this to say it goes broader than being mistaken for being a nurse or being a med student or being a resident or being a staff person. And by the way, it's nothing wrong with all of the people that we have working in our office, right? Everyone is a valued member of the team. But this is the thing, we know that implicit bias exists. That means we all have biases. We all have things that we think and that we just assume. We may see somebody that's a certain gender, a certain height, a certain shape, a certain this, a certain that, and assume that they must be the doctor or they must be the nurse. The problem with that is that our implicit bias is not necessarily a reflection of reality. So it's really, really important that when you come to your office, you may not know who someone is. It's okay to ask, "Oh, excuse me, I'm sorry. What's your role?" Or, I'm sorry, I didn't catch your name or your title or something like that." Okay, it's okay to let us know you don't know who we are, but assuming that we're the nurse or the med student or what have you. I say this from experience. Sometimes if you look young, if you look a certain way, people and patients may not assume that you're the doctor when you are. So we all have to make sure that we're checking our implicit bias at the door. Doctors need to do the same. If you don't know if the person walking in the room is your doctor, you can ask them or simply read their name tag. Take a look at their name tag. Take a look, or, if you get a chance, ask the staff person when they come in, who am I going to be seeing today? Am I seeing the nurse practitioner? Am I seeing the doctor? Are there med students? Who's going to be coming in first? And again, asking us is always better than assuming. Okay. We know that people don't mean any harm, but this does happen. All right. And I would say, let's see here. The fifth thing that I advise you not to say to your doctor is I would advise you not to say no before you know why your doctor wants you to say yes. Example, your doctor wants to start you on a new medication for your blood pressure, for your cholesterol. Maybe they want to start you on a specific brand, okay? But maybe maybe you've heard things about this brand of medication, your friend or your family member didn't do well with it and you don't want it. Rather than just saying no, okay, which a lot of people do, you need to talk about really what your concerns are. If your doctor doesn't take the time to figure out why you're saying no, they may just move on to the next thing without addressing your concerns. And the truth of the matter is, the medication they might have had in mind, or the idea of even treating you in the first place, might be to your benefit. It may be that the medication you actually want, the brand you actually want because you heard good things about it, actually may not be the best for you. So I always say, you always have the right to say no, to say yes, etc. You have autonomy over your body, and that's the way it should be. But I always say informed decision making is really the best thing. Before you tell a doctor, no, I don't want to do this or take this, make sure you know why they want you to and what could happen if you don't. And likewise, before you say yes to, I will take this, you also want to know what the potential side effects are. And also, again, why you're taking it, why your doctor wants you to take it. So those are 5 things that you should never say to your doctor. Many of those have qualifications or qualifying statements. Don't say this to your doctor until, etc. But in the case of, arguing or having difficulty with the staff and then not saying it to us, it often happens that there are things that you should be saying to us that maybe you aren't. And of course, the implicit bias, assuming that we are the med student or the resident or the nurse, by the way, is always, we assume, just sort of a simple mistake. However, it does play, it's always a nice thing when patients take the time to look at name tags or ask who they're going to be seeing rather than assuming. So guys, I hope this is helpful. I'm Dr. Jen Caudle, practicing family physician, honor health expert, and video creator. I do videos on all sorts of stuff, especially the doctor-patient relationship and how we maneuver in the office. For those of you on Facebook, if you've not liked and followed my page, please do, and consider joining my subscription groups, Dr. Jen Superstars. And for those of you on YouTube, hello, it's good to see you. Please subscribe to my channel and click the little bell for updates. And also let me know in the comments if there are other things that you don't think patients should say to their doctors. All right, guys, talk to you soon. Bye, YouTube.